Some tips for parents to facilitate language development in their ASD child. You want to help them speak as soon as possible. The reason is there is a critical period for language development. And I'm going to be I'm estimating the period, which is do your best to get your child to be able to speak before age 7. After age 7, it is harder to learn language and to learn speech. And it doesn't mean that all hope is lost after age 7. You can, but it's easier. The earlier you teach them, the better it is. So, number 1, keep calm and carry on. Try not to get distressed when your child is distressed. Remember, nonverbal equals anxiety. Not being able to speak is very frustrating. Having everyone around you take you for granted, misunderstand you, is just not very nice, right? And not very good. Of course, there will be distress. So find the steadiness in yourself when your ASD child is crying. And at the same time, aim to connect with the struggling person. Give your child space. Try not to shut him or her down immediately. It's not the crying and the distress that is the issue here. It's about keeping them comfortable, helping them know that they are okay, and think of something pleasant, redirect them. And also help the person who is nonverbal find ways to talk to you. Remember, there are pictures. You can show them a variety of pictures. Which one do you want? Which one would you pick? Or maybe a speech device. You can train them to use a speech device to drag down the icon that is there. So when you're in the public, explain to your child who is going through a meltdown that it's okay to be upset. Everything is going to be okay. Now, you don't have to be embarrassed. If people are looking at you, you don't have to apologize. If the audience is receptive, you can share that your child, he or she, has autism and everything is under control. It may look worse than what it is. Nevertheless, keep calm, carry on, and know that this phase will pass once your struggling child finds his or her footing. Secondly, be prepared. Have a list of choice available, whether it's picture form, visual, tactile, something even in this day of 3D printing. So some people connect better with things in their hand. They need to feel it. In fact, it calms them down. Give them choice in terms of something that they can feel that's tactile. And they can also look at electronically, the phone. What is it? You can prepare a list of things that they usually want. And they can look at the phone and they can calm down. So before you go out in the day, have a list of choice available. Train your ASD child to accept all these choices. Now, of course, sometimes the choice that is given is not on offer. We would also have to train them to accept not having anything too. And just waiting, not having anything is okay. Ask your professional to put this in his or her program, because we cannot produce everything that they want at that time. They have to learn to accept no and to accept needing to wait. And the next thing is having a daily routine, having a schedule is helpful. Many ASD individuals don't do very well with transition because it affects the processing, and also sudden changes can be distressing. So if it cannot be avoided, explain to them, we are planning to do X, but something else happened. Y happens. These are the choices that is available for you to do. You are okay. Keep talking to your nonverbal as though she or he can speak. Do not assume that because they are silent, they are not in the room. They do understand. And actually, I do have something funny to share. I've had a client who has been non-verbal for a long time, who eventually is able to speak. Some of the story that he shared with us is hilarious because people thought that because he's nonverbal, he doesn't understand and he's not in the room. Yes, he is. Explain what you're going to do. And the fact that he or she cannot talk does not mean that they are not participating, even if you are dragging them around to your routine chores. Help them understand and include them in your daily event. Thirdly, set expectations. Do you know each of us rise to the expectation that has been set by others, especially parents? If our expectation is too low, of course, they're not going to get there. If our expectation is too high, of course, they would not reach it. Set doable, achievable expectation in the day. Tell your child, we're going to either do this or that, and I know you would let me know which is preferable, yes or no. You can expect them to be able to communicate that much, whether by pointing, whether by eye gaze, whether by read their body language, the sense of excitement in the body. So you're communicating and you're expecting you're going to have a good day. There is no need to get upset. And this is what you can do. If things doesn't happen the way you want them, we're going to prepare ahead. Everything will be good. And the day will be wonderful. Once you set the expectation, chances are they will meet it. Give them the opportunity to also ask for something that they want to do. Don't assume that they like something. It's going to take time to train this. Be patient. They won't be able to do it the first few times. You may have to give them 20, 30 trials to be able to know what it is that they want you to do. You show them this is how you do it. You physically guide them. You give them time to communicate, show you what he or she wants. And when your child actually does it, be very happy and praise them. Praise them when they make the effort. Don't just praise them when they're not doing very much. We want to reward the effort. Document what your child has said and communicated, especially give it to your professional, because your professional can expand the vocabulary, can work on this. This is go. And the next thing I would like to share is some of the data that we have collected from one of our volunteers who agree for the data to be publicized. So there's always been some discussion on what is the best way to teach language. So one of the ways will be through a co-wic. A co-wic means, say, cat. Can you repeat cat? Say dog, say apple. And this is something that we all do without training. And we show that a co-wics actually did not really have very much effect. So the other way to do it is sign language. Say cat and use sign language to teach cat. So you can see 40% and 40 to 60% improvement when we teach sign. This is specific to this child, of course. Picture exchange for this child is the best. So it looks like text is the way to go for this child. We try different ways and we find the modality that works best, and then we go forward. You can do the same with your child. Some of them may prefer augmentative, like the iPad device, that works as well. So this is some of the research publication from Journal of Applied Behavior Analysis on the intervention modality. So they are divided into three phases. Discrete trial, which means you give the instruction, you help them, you show them, you physically guide them, and when they do the right thing, you reinforce them, or in lay terms, you praise them, you're really happy, you reward them. This is basically the format in which you can teach them, right? Be very clear, do this, say this, sign this, show them. If they do it, reward them in lay terms, right? And in our hands, we find that the augmentative communication device, whether through the iPad, speech device, there are many apps that's available, tend to be the most preferred. So we have used this. And do not forget socially mediated learning. Earlier on, we have talked about the importance of training them to like approaching others, to like interacting others. So setting up motivation to interact with others reciprocally, that means back and forth, not just playing by themselves without looking at others. It's very important because speech and communication is part of social interaction. So we need to foster social interaction, play together, figure out games requiring participation of everyone in the group. If you're in a family, maybe you can do something together as a family. And families who play together speak to each other. And these are some of the forms that we have that just give us some idea of the best way to teach a child. So for those parents who come to us for services, we do go through it with some extensive questions, and then we create a program. And these are some of the speech generating devices with the link, and common ones, Proloquo, Pep Speak Choice, My First AAC. Some of them are favorites, and everyone has their own favorite. You may want to try them. So at this point, I would stop here, and I would like to summarize the topics that we have been through. So yes, you can facilitate language development in your ASD child. It's important to calm your child down, and it's important to prepare for the day and to be organized, and also to set expectation, to show, to do, and to reward. So the other things that you can learn is what is the best speech modality to teach and to use in your daily life. Thank you.